Hello, my name is Dr. Bates and I am a preventive medicine resident physician with the University of Rochester Medical Center. Today, I will be presenting for you the Scott Health Talk on migraines. Before I begin, I want to clarify that everyone is unique and people experience migraines uniquely. If you are having new, different, or extreme head pain, or something unexpected is happening to your body or your ability to think or move, please seek medical attention immediately. Migraines are classified as a type of headache. What makes migraines different than other forms of headache is a specific mixture of symptoms and diagnostic criteria that needs to be met in order to rule out other potentially life-threatening causes of head pain. In fact, technically all migraines require at least 5 attacks before a diagnosis is considered confirmed. Typically, a migraine is a form of head pain that can be categorized into 4 stages. First, there is the prodrome. This is a pre-headache phase of a migraine and is usually marked by feeling off. Symptoms like feeling unexpectedly stiff, sore, angry, hungry, or nauseous. Sometimes this can make it hard to read or focus. Lights might seem too bright or sound too loud. These symptoms can change in type and severity and can last sometimes up to hours and days before head pain begins. The second phase, the aura, is a phase of migraine that only affects about 30% of people with migraines. Aura is a temporary neurological change to one or more bodily functions. This includes vision, hearing, sensations, movement, and or language. These changes are temporary, usually associated with the head pain, but often resolve after 30 minutes. However, from a physician's standpoint, these symptoms in and of themselves are concerning and absolutely should not be dismissed, especially if they are new, as these symptoms can also be caused by a range of other illnesses such as stroke or retinal detachment. The next phase is head pain. This head pain is often on one side of the head, but it can be on both sides of the head. It is often described as pulsing. Light, sound, smells, and movement as simple as walking can be extremely uncomfortable and make the pain worse. This pain can be accompanied by stomach issues such as nausea and vomiting. This kind of debilitating pain can make everyday activities inaccessible and usually lasts between 4 hours and 3 days. Finally, the fourth phase is the postdrome or migraine hangover. This is after the headache has passed, but the body has not fully recovered from the migraine. People report feeling tired, achy, and there may be some lingering issues with concentration, dizziness, and sensitivity to light and sound. In summary, migraines are very unpleasant, so it is important to recognize things that may be making them worse. Here are some examples of things we have found that can trigger or worsen the impact of migraines. The first thing is stress. Things that can cause the body physical stress include a lack of sleep, hunger, and the menstrual cycle. Things that cause mental stress include anxiety, feelings of instability or powerlessness. The triggers can be related to your diet. Specific things that are consumed that can been shown to set off or worsen migraines include alcohol, artificial sweeteners, highly processed food, caffeine, and tobacco products. The environment itself, such as bright flickering lights or even changes in the weather, are also things that can induce a migraine. If you are concerned that a medication you are taking may be related to your head pain, please speak to your doctor. This list is by no means inclusive. In fact, because people are unique, head pain is unique, and migraines are unique, I recommend taking steps to specifically outline your head pain experience. To help keep track of migraines, I strongly recommend beginning a headache journal. For this journal, I would recommend you include the date of the headache, the day of the week, when the symptoms started, potential triggers including what you were doing at the time the headache began, how long the head pain lasted, how long until you felt back to your normal, how strong was the headache, which can be reported as mild, moderate, or severe, any other symptoms you experienced alongside the headache, such as dizziness, vertigo, sensitivity of light, sound, smells, or any other symptoms that affect you or your movement, How severe were these other symptoms? In addition, I would include any medications you took and if you took a second dose of those medications, as well as anything else you think might be helpful. Keeping track of these things can help both you figure out potential patterns of your head pain and can help your doctor find the best treatment for you. Other things that can help prevent migraines are reducing stressors, getting enough but not too much sleep, being properly hydrated, avoiding hunger through eating frequent small meals, aerobic exercise, as well as removing stimulants such as caffeine and nicotine. Remember, when it comes to migraines, it takes 6 weeks of being caffeine free for the body to be completely reset after removing caffeine from your diet. Steps needed to take to help prevent migraines can be a long journey, but it is worth the effort. Migraines are an ailment with many symptoms that mimic very dangerous medical issues, so it is essential that if you develop sudden, extreme pain, symptoms you don't recognize, or any issues I have listed here, you seek medical intervention immediately. Furthermore, consider calling your doctor or scheduling an appointment if your pain is occurring more often than usual, becoming more painful than usual, isn't being affected by the medications that typically work. If you feel like you're taking these medications very often, if the pain is limiting your ability to function, or even if you simply have questions or concerns. As a healthcare provider, we are here to help. Thank you for your time. Have a wonderful day.